Hello, my name is Kevin Sevarino, and thank you for inviting the American Academy of Addiction Psychiatry to the World Table, for which we are honored. Today, I'm representing AAAP as its immediate past president. My name is Kevin Sevarino, and I'm speaking to you from Connecticut in the United States. AAAP represents 1,650 members, the subspecialty of addiction psychiatry within general psychiatry. Physicians who have completed their general psychiatry residency undergo additional specialty training for 1 to 2 years in a fellowship to obtain their subspecialty certification. Our members have particular strength in the treatment of co-occurring addictions and other psychiatric disorders. Along with the American Society of Addiction Medicine, the American Osteopathic Academy of Addiction Medicine, advanced practice nurses, and physician assistants, our main goal is to move the needle forward in addiction treatment. We have much of the science available to us, but the effort remains great to overcome the treatment, not only of addictions, but those with addictive disorders. We face large financial barriers, as I'm sure you are all aware throughout the world, to improving care, especially to the needy and minoritized populations. And we've not achieved parity for the treatment of mental illnesses compared to other chronic conditions. This, despite the fact that mental illnesses represent perhaps one of the largest burdens of disability worldwide. We fight a fractured healthcare system in the United States that seeks to keep addiction treatment separate from other psychiatric disorders, and as well outside of the House of Medicine in general. Our main focus in AAAP in the last 10 years has been to work with SAMHSA on a number of national level grants, including the Providers Clinical Support System, the Opioid Response Network, and the Opioid Fellowship Grant Program. These involve coalitions of over 1.4 million prescribers worldwide. We hope through our interactions with ASAM to be able to not only learn more about and diversify our knowledge here in the United States, but as well to use some of these educational resources, we hope, to provide some of that knowledge outside of the United States. And we already have ASAM participating in AAAP's annual meeting. This year, Greg Bunt put together an excellent symposium on cannabis, and we hope to participate more actively in ISAM's meetings, including the one coming up in Malta. So thank you very much for having us, and we look forward to more work together.
Bill Hanning from the United States.
From Bill. Hawaii, Bill. Welcome, Bill. And what time is it in Hawaii right now?
It appears to be, my vision is a little blurry at this hour. It appears to be 2:20 right now. So that's.
Okay, thank you for joining us. Thank you. Go ahead.
Thank you for having us. So good morning, good afternoon, and good evening. I'm Bill Hanning, a professor at the University of Hawaii, John A. Burns School of Medicine, and I was last with you folks at the forensic panel of last year's International Society of Addiction Medicine Conference. I'm president of ASAM, formerly the rather less euphonious acronym of AMSAOD, American Medical Society of Alcoholism and Other Drug Dependencies. Consider yourself blessed if that doesn't translate well. Here would be what my society would like me to convey to you. We're over 7,000 members. We have a 70-year history, actually founded in 1954. The present situation in this organization, really, in terms of our priorities that would coincide with ISAM's, keeping in mind that we are 46 chapters organized by states. And of course, in the great American tradition, each and every one of them thinks it is a separate little nation. Nonetheless, we get together several times a year and manage to hammer out agreed upon courses of action. The challenge since the inception of ASAM has been to educate everybody, policymakers, clinicians, researchers, families, regarding the disease nature of addiction. That hasn't changed. One more immediate ambition has been to coalesce resources among the many U.S. organizations. That's for us, the U.S. organizations accountable for the treatment of addiction. And there are so many of these. The students always are boggled that we've got an ASAM, an ACAM, an AAAP, CPDD, MRSA. One of the great skills one develops in being in this field is an ability to trippingly bring those acronyms off the tongue. Let's go to that next slide, which is a little bit more about what we'd like to be able to do with you. It's an opportunity to participate in the development of better clinical services, education, and research internationally. That implies a degree of bilateral recognition of both our shared problems and our unique problems conferred upon us by geography and economy. I'd like, in particular, on behalf of the Society, an audit of what it is that we in the United States are doing right and of what we are doing wrong in the treatment of addiction, of course. And examples would be in the case of what we do right. We do research reasonably well in this country. What we do wrong, if not terribly, is take care of people who are in the criminal justice system, the folks who are inmates, prisoners. What we should like to see ISAM contribute to the global community, well, that's of course entirely in your register, but what we would provide to you, or what I would like us to have more access available, is educational resources. Another thing that we do reasonably well through ASAM, and as a result of having a superb staff with which to put forward this education. Ultimately, improvement in the standard of care, which we've embarked upon with the ASAM criteria, now coming out in different application form. And I think I have managed to break the 2-minute mark. I'm very proud and pleased with myself for that. I hope you'll tolerate my racing through that. Thanks very much. I'm done.
Thank you very much, Bill. Thank you. Let's move to the next speaker. We have Jen Brasch and David Martell from Canada.
Hello, everyone. Unfortunately, the meeting capacity is capped at 100, and my colleague Dave Martell is unable to join us. Okay, he cannot get into the meeting, and there's lots in the chat that others can't get in, just so the organizers are aware. So I will.
I'm really sorry about that. I mean, what we have in this account, we have 500 cap. I don't know what is the problem right now, but I'm really sorry about that.
Okay, thank you. So I am Jen Brasch. We just zipped through my slide. I'm president, and I wish I was here with Dave Martell, president-elect. We are pleased to participate in this important meeting and to connect with addiction medicine professionals from around the world. Next slide, please. CSAM is the national organization for healthcare professionals in addiction medicine in Canada. Members have only been physicians and PhD researchers, but we are now expanding full membership to all regulated health professionals. This will help us grow our organization and better reflect the multidisciplinary practice of addiction care in Canada. CSAM is led by a board of directors that includes a 4-member executive team, all voluntary. We have just under 500 members at this time. We host a large annual conference, but since the start of the pandemic, have moved to expand the resources on our website and to offer additional online activities, such as a monthly newsletter, journal club, and educational sessions for medical students. We offer a certification program, although national licensing boards are now offering credentialing in addiction medicine. Current issues facing addictions in Canada include the opioid pandemic, as has struck many other countries around the world, and poisoning of the illicit drug supply. Canada is one of the few countries involved in the prescription of a safer supply of medications. There's lots of debate and discussion around that, needless to say. Alcohol and tobacco addiction are our most frequent addictions. We recently legalized cannabis nationally in Canada, and that is also a significant issue. CSAM released a policy paper on decriminalization of drugs last year, which several national medical organizations have endorsed. Next slide, please. We hope that the Canadian organization can become more involved in international addiction initiatives, would welcome involvement in our conferences, and hope that we can share our experiences and support for global and regional initiatives. Thank you.